As we have learned, similar to physical health, behavioral health challenges do not skip any demographic group. Anyone can experience these challenges, regardless of age, gender, race, or ethnicity. However, how an individual deals with these challenges is tied to that person's lived experience, culture, beliefs, and more. Evidence-based practices therefore recommend that the care a person receives should reflect the person's culture and identity. Latest data released by the National Alliance on Mental Illness, NAMI, underscores that racial and ethnic minorities receive treatment at far lower rates than white individuals. For example, in 2022, just 25% of Asian adults with a mental health diagnosis receive treatment or counseling compared to 52% of white adults. We have today a very impressive and diverse panel of youth leaders, Meher, Roshan, and Roshit, as well as experts in healthcare and education that will address some of the complex issues related to behavioral health. You will hear from each of the panelists, followed by a brief Q&A. Please share any questions you might have in the chat once it is opened. Before we proceed, I would like to invite Dr. Thomas Abraham, Chairman of GOPIO International and Trustee GOPIO Connecticut, to say a few words.
Good evening. Thank you, Anita. Greetings from GOPIO International. It is wonderful that we are gathered here for this evening recognizing Mental Health Month. It is also wonderful to see youth of our community and looking forward to hear their perspective. A few words about GOPIO. GOPIO International is an international organization started in 1989 in New York, which has over 100 chapters in 35 countries. GOPIO Connecticut is one of the most active chapters. The chapter not only celebrates national holidays of India, but also provides community services to our local Stamford and Fairfield communities. We also support many charities. We support New Covenant House, sponsoring soup kitchens, and we are looking for sponsors for the rest of the year. We have supported other service organizations in this area, such as Women's Mentoring Network, Future 5, Children's Learning Center, Teach for America, Building One Community, Grassroots, Mill River Park Collaborative. We had also contributed and replenished food pantries during the COVID time. Our chapter will be participating at the Hope in Motion walk at Mill River Park to benefit Bennett Cancer Center on Sunday, June 11. We invite you to join our team. Have a fruitful panel discussion this evening, and thank you.
Thanks, Thomas. I would now like to introduce the current GOPIO Connecticut president and the inspiration behind this event, Dr. Jaya Daptardar. Jaya is an Ayurvedic doctor and healthcare executive. She works as the Chief Compliance Officer and Chief Strategy Officer at Bridges Healthcare in Connecticut. She also serves on the Connecticut Certification Board as a treasurer. Jaya works with several nonprofit organizations and is a recipient of Community Service Awards and Lifetime Achievement Award for Community Work and Health and Wellness Services globally. Jaya has received a Dharma Award for her work in health and wellness. So Jaya, over to you.
Thank you, Anita. Thank you for a lovely introduction, and welcome you all to celebrate mental health awareness. Today's topic is behavioral health, stigma, wellness, and prevention. Today, we have Dr. Mohini Ranganathan on the panel. Mini Santosh and I are going to present. I would like to invite Dr. Mohini Ranganathan. She is Associate Professor of Psychiatry at Yale University School of Medicine and a psychiatrist at the VA Hospital in Connecticut. She's originally from India. She graduated from Calicut Medical College in Kerala before immigrating to United States and completed her psychiatry training at SUNY Downstate in Brooklyn and Yale University. She's also a clinical researcher with particular expertise in cannabis and its components and how they interact with mental health. So Dr. Mohini, over to you.
Good evening, everyone. Thank you, Jaya, for that introduction. And it is really my pleasure to be here today. As a psychiatrist and researcher, most of my talks are to academics or scientists. And while that is awesome, I think this is the true audience. This is who really we want to be communicating with, I want to be communicating with. And especially as I've advanced in age and career, I found this more and more meaningful and really want to give back to my community. So thank you for having me here today. And thank you for recognizing how important this is. So I'll start with telling you a teeny bit about myself. I'm an adult psychiatrist. My work is primarily at the VA hospital in West Haven, where I treat veterans. And I do general psychiatry. So I'm treating conditions such as depression, anxiety, bipolar disorder, schizophrenia, comorbid substance use, anxiety disorders, including PTSD. And that range from mild symptomatology to severe and treatment refractory illness. And I run the treatment refractory depression clinic there. And my clinical research is at the VA and also at Yale. I do not have a private practice, and I only treat patients within these two organizations. However, especially over the last few years, I have really felt maybe I should start a private practice, especially focused on the Indian immigrant community and the broader Indian diaspora. And some of that is merely because as I'm, growing older, my kids are growing older, my colleagues, my friends are in my same age group. And I receive so many calls on a weekly basis, sometimes for themselves, sometimes for their family, their children, their spouse, their parents. And one thing has become very, very apparent. It doesn't matter if you went to medical school and got a medical education or not. There are so many misconceptions around mental health and mental illness. And there are so many real, so logistical, but also psychological roadblocks to identifying and seeking help and then accepting the help. So I think this is an awesome place to start so that we can actually talk about it, bring it out of the shadows. And I am super inspired by our young folks on the call today. I'm sure they will have much really more relevant information to give us. And I'm delighted that our next generation is kind of leading the way forward here. So I'll start with an anecdote. I think psychiatry and mental health, more than perhaps most of medicine, is really personal stories and anecdotes. And I think, Anita, you mentioned that lived experience, right? It plays a key role not only in how we experience mental health and mental illness. And please note, I say both of them because both are equally important. Good mental health, that is maybe absence or not much mental illness, but also mental illness. And that also influences how we seek treatment or whether we seek treatment. So this is around about 2005 or 2006. I actually lived in Stamford at that time. And I was on the call with my grandmother. She lived in India, in Bangalore. She was in her 80s, and she had many medical problems, chronic pain, collapsed vertebrae, cardiac illness, etc. But she was very active in the community. And she had been progressively deteriorating in physical health. And I think she perhaps always had a little bit of maybe depression before these medical problems, but it certainly was getting worse and worse. And so I was a freshly minted psychiatrist, and I, thought I can give her some advice. And I said to her, I think you should go on this medication. I think that's going to help you. You're struggling with sleep. Maybe it's going to help you with sleep. You're struggling with anxiety. This is really good for anxiety. You've lost so much weight. This is one of those medicines that's going to help you a little bit with appetite, and it's going to help your mood. And she said, what do you mean my mood? And I said, you've been feeling fairly low. You're sad. You've told me that you're really thinking about your life, how so many things have gone wrong. I think you might have some depression, and this medicine will help you. And she said to me, and I quote, Ama di Nandan Paityam, which, if you're in Tamil, translates to, yeah, I'm the crazy one. And that effectively shut down the conversation that day. But thankfully, both she and I were able to keep the conversation going. And eventually she did go on a medicine, it's called mirtazapine. She went on a teeny dose, and she still struggled with many medical problems, as well as perhaps mood and anxiety. But I think it made a small bit of difference. It improved her quality of life. It helped her cope with some of these problems. So why do I tell you this anecdote? I think this anecdote reflects, to some degree, the spectrum of responses that are particularly true of the Indian community. Whether back in India or Indians who have immigrated to the United States, we carry some of those beliefs that mental health and mental illness is something that happens to other people. We should, it doesn't happen to us. And yeah, if I have it, I must be crazy. And I think we need to really mainstream it. We need to bring it out of those shadows. As Anita said, mental illness is not unique to any race, any ethnicity, any gender, any age group. It affects us all equally. And I would actually argue that it might affect many of us even more. And I'll get into that in a second. And so I'd like to take this opportunity. So if you leave this conversation with not remembering too much more of what I say, I'd like you to remember that one rejection or one withdrawal from a conversation offering help need not mean that you can never seek help. Certainly in my grandmother's case, she went on to receiving and accepting help from me and her doctor in India, and it did make some difference to her quality of life. So it's not one and done, whether that's for yourself or for someone else you're talking to and trying to convince them to accept some help. All right. So today we're going to talk about the importance of mental health, the importance of recognizing when mental health is not, completely there, and there are some aspects of mental illness. I'm not going to talk about specific diagnoses or specific treatments, but I'm going to use an example of depression and anxiety because these are really, really common disorders. We know that they are highly prevalent in adults and children and young adults and adolescents. We also know that the rates are increasing amongst young adults and adolescents. And that may reflect increased acceptance and being willing to seek care or being willing to talk more about it. But the pandemic also did a number on us, and we know that it has had an impact on mental health. And what I'm going to talk about is really to focus on why is it important. So mental health is not separable from the rest of our health. It is as integral to our well-being as physical health. We would never say, yes, your heart is not that healthy. Maybe you have cardiac illness, but the rest of your body is working fine. Let's just move on from there. We would never say that, right? And similarly, mental health is integral. it directly influences our physical health and overall well-being, and our physical health and overall well-being influences our mental health. So we just need to embrace it as part of our whole self. So the second reason why I think it's really important is because it is hard to capture. There isn't a blood test you do and you get a result and you know what's going on, right? And it's highly subjective. So what I feel is anxiety provoking, or my experience of anxiety, is different from every other person's experience of that. And so it sometimes leads to conversations. I told you yeah, I'm crazy, but the second one would be, I'm not that ill, it's not so bad. I can go to work, I can kind of do everything. I'm just like, I can manage within myself, and I should be able to. And the third is, it doesn't happen to me. It happens to other people. I know such and such person, they struggled with it, but I'm fine. And actually, individuals who are higher functioning, perhaps collect those resources, whether they are internal resources or whether they're external. You're outsourcing certain things in your life, and can pull it together. So you look okay going to work, socializing, going for the Diwali party or the Eid party, going to school. You're even doing fine with grades and performance, but it comes at a cost, and the cost is your mental health. Like, you're keeping it all together, you're holding it together, getting through the day, and then you kind of are letting, when you're alone at night is when you're accepting some of these things. So so it's really, really important to have some awareness around this. And what are some factors that are necessary for us to be aware? At least till my generation. So when I went to medical college in the 90s, psychiatry was not prominent in our training, and nor was it prominent in our rotations. And it was not a very popular choice either. And so it has changed now. I'm delighted to know that. I think it reflects change in our society and more acceptance. And it also reflects that we're learning a little bit more from neuroscience and other aspects and psychological sciences about how our brain circuitry and our response to stress and how we integrate everything together affects our well-being and our mental health. And so what that means in a way for people my age, or I'm not going to tell you my age, people around my age with children and adolescents or young adults as children, or even younger kids, is not only do we have a little generation gap, which is there for everybody, but we have a little cultural gap in knowledge. So our kids are really far ahead of us in learning more about mental health. They're having all these conversations, whether it's in school, with their friends, online, when they're playing video games, they're having these conversations, but we are not, right? And so we are not able to participate in those conversations with them sometimes. Whether that's because we want to reject it, whether it's because we feel we don't have the capacity to have those conversations, or we don't know the jargon, we don't know what this means. If your child says, I'm feeling really sad and depressed, you might be tempted to say, well, it happens. We all have had these moments. Your grades are not so good right now. This is okay. This is fine. It's not a big deal. And you may be right. It might be transient. It might not be something more significant, but I'll encourage you to maybe continue that conversation rather than providing an answer to what is causing it and what is not causing it. Because the truth of the matter is we don't know. And this is true for all parenting conversations, right? But it's probably very true for conversations around mental health and substance use. Right, so gaining more knowledge. And there are so many sources of knowledge nowadays. It's hard, it's just impossible to list. And people often go to various resources online. The challenge is figuring out which are real, which should be shunned. I always, want to give a shout out to NAMI. It is a wonderful, wonderful nationwide organization. Not only do they have chapters where you can go and learn more stuff in person, but they have a website and resources from where you can gain information as well. And you can usually find someone you can reach out to if you really are struggling with questions. But certainly people will go to WebMD or some other website and get information themselves as well. So gaining information. And you might be wondering, I don't know what she's saying. What do you mean? Should I go and start Googling different type of mental illnesses today? No. And we don't do that for physical illnesses as well. But being receptive to information and knowing where to reach out for information, especially when conversations are coming, can be really helpful. But along with knowledge or sources of information is an open mind. So keeping an open mind so that we can have these conversations and we don't feel we have to shun them, whether it's because of lack of knowledge or stigma or the shame that comes with it, is really critical. It's not going to be one day. I mean, all of you have an open mind, clearly, because you're here today and you'd like to engage in this conversation. And that might not be true for maybe other people in your lives or people you know. But having access to conversations, participating in events like this or other, personal conversations is always a way to extend that. And related to that, I just wanted to point out, recognizing is so having information awareness, recognizing it is another one. Sometimes you're tempted to identify your own or someone near you, their illness. And that is great because you're at least keeping an open mind, but it's also risky because sometimes you might be reaching conclusions that are not fully warranted. So I would recommend really finding pathways to access that expertise. And there are so many pathways now. I always give a shout out to primary care physicians or pediatricians. All of us see them at some point or the other in our lives. And they are extremely well trained in having these conversations. It's part of it's integral to their training and certainly an easy common pathway. But teachers, friends, parents, early education specialists, and certainly reaching out to experts in the field if that is what you feel is appropriate. And if you're trying to decide, should I or shouldn't I, it's much better to do it. So if you're trying to think, should I reach out for help? That means you should. So don't then answer yourself, no, I should not. What's the worst that will happen? You reach out and the person who reaches out will do an evaluation and say, you know what? I know you're struggling with this right now, but it doesn't look like you need long-term treatment. And that's wonderful news, right? So you can just move on from there. Not reaching out for help means you still don't know where things are going. Am I out of time? Where are we? I can't hear you, sorry.
Yeah, you have 1 minute, maybe.
Awesome.
Yeah.
So I'm going to stop with our approach and say, there are biological factors, psychological factors, and social factors that affect mental health and mental illness, and our treatment is tailored to that. So seeing someone for illness or seeing someone and getting diagnosed with a mental illness doesn't always mean you have to take medications. I think medications work and they are certainly part of that treatment course. But if you're worried that, oh gosh, if I say this to someone, they're going to force me to take medications, that's absolutely not true. And there are several ways you can access care without necessarily going on medications, unless it's the appropriate choice. And then I hope you'll be open to it. All right, I'm going to stop there. Thank you so much again for having me on.
Thank you. Thank you so much, Dr. Mohini. It was so helpful and needed. So now I would like to invite Mini Santosh. She is an early childhood educator, advocate, and activist. She was a principal of an international school in Bangalore, in India, before immigrating to United States. That was 30 years back. She works now as an early childhood director with Community Action Agency of Western Connecticut. Mini Santosh sits on many boards to advocate for children of immigrant families and English language learners. Mini Santosh is passionate about equity in education. So with that, over to Mini Santosh.
Good evening. That was a beautiful introduction, Dr. Jaya. So you did talk a little bit about myself, and I'm here in the same capacity. Dr. Mohini did talk about the diagnosis part of it. The the place, my landscape is how does the community kind of gather together to help families and parents, I would say, and parents of teens who are struggling in these conditions, because they are real and the struggle is real and it has to be fixed. And it takes a whole community to raise a child, and it takes a whole community to gather families, put them together, rather than finding them in pieces. So that's how I look at it. So that's the reason I sit on tables where I say, hey, if you have a problem, do you have a way to fix it? And one of the problems that's gotten so critical just recently is mental health. Right from the ages of birth through 5 is my industry, but even beyond, we see it is so critical that parents feel that it is something to be fearful about to discuss, something to be shamed about to discuss, which is not true. There are so many resources which is put together for the same reason, but you have to reach out to it. Like if mental health is honestly a key part of human health. Dr. Mohini talked about it. So it is a key part of human health. And if you look at it in the same capacity as it's defined, it is, if you're going to a doctor for a broken tooth to fix it, you're going to, of a broken bone, then if that complicated part of your body needs some help, reach out for help. Reach out for help. That's, it's important you take it seriously. It's important parents take it seriously. And how do the community it starts from home, right? The community starts from home, parents. Listen to your kids, open up those conversations with your kids. When I sit on these tables as an activist, as an advocate for kids, I talk to the parents, telling the parents it's not the kids as yet, it is where you are. How open are you to these conversations that they can bring it to your attention? They can have that. Can you be a listener? Just sit down and listen to them in silence. Let them defend for themselves. It's okay. They're going through a constant battle, and you want to make them feel you're not alone. We are with them. And your community starts at home. The child, the teen there are symptoms you get to see. They're frustrated. That's the first level. You see them frustrated. They shout out. That's the first goal. Let them shout out. Anger, that's the first goal. Let them show that, because instead of being bottled up, let them bring it out. And you are being the first in that list, the children call as community. You put them together, give them that space to listen in to them. And if you lose them for a while, start the conversation again with them. Don't leave it at that. If you see drugs or you substance abuse or social media kind of things are contributing to the space they are in, troubled space, figure it out, help them, seek out, there are resources in the community that will support you for that. Reach out to the pediatrist. The referrals will be made and should be made. What happens in most communities, when we're talking about stigma, which is big, it is big. Stereotyping and it's not new at all. We have seen this it's been there for years. I always go back to my own self. I said, if there was any diagnosis done many years back, I probably was ADHD. I don't know. I'm just being honest about it. There was none those days, because I was a very hyperactive child, high energy child, a child who needed more attention than my siblings. I probably would have put in that. It was a constant struggle in the family to put my pieces of life together and gather it up and say, okay, you're ready for tomorrow. And the next day I'm falling apart. So it's very personal. This is very personal for me. I've even trying to go back to a simple example I can share is when my mother-in-law was diagnosed with cancer. She is no more. We celebrated her heavenly birthday a few months back. But when she did go through cancer, it was final stage. We know exactly what she was going through, but what bothered her more was she got into that space where she was alone. She trying to figure out that, why did she get there? How did this happen? Why me? Why me? That kept bothering her. And there were a whole group of medical group attending to her, the cancer part of it, but there was no help around the part where her mental health, she was struggling with a condition which needed help. There was none. The community here, we put together a little directly, like I call it a directory of friends who visited her every single day. We made sure somebody visited her, sat with her, boosted her up. I do see some people on the screen today, but they were there. We had that little list. Okay, Monday it's Johnny, Tuesday it's John. So we had a list that one person would visit her, sit with her, get through the process. But because the medical field failed, because they were pretty much focused on her medical condition. This person who was 80 years old was going through a struggle up there, had complicated, she was in a space where she was in denial. And that's a very sad solitude state when a person is there and very alone. It is, to me, that's bigger than the medical condition. But this is where we say, how does the community do it? So I hope to see in my own lifetime, schools prepare kids, not just for jobs, but how to react to something thrown their way when life is just not too happy. It's not what they thought. Their conscious, unconscious relationships are not bringing them the pleasure they thought. The schools have to prepare them. That's where I sit on my space in those panels, or where I say, what do schools do for these kids? I'm back to see, I'm looking forward to see what these kids have to offer today. And I hope they go to every table on those Board of Ed tables around Connecticut to bring this, because it's so much needed. They have forgotten that there is more than getting kids ready with the skill set to get a job. Every child out there will find something of their own. Their brain will take them, or their happiness, wherever they derive it, they'll get there. But what happens if they are alone in a space that they feel that they're left out, they're shamed, they are fearful, they don't even trust their own parents to talk to. They've been there. This is very close, very personal for me, because I've sat across in tables where young teens have gathered their kids to take care of them, while they say, my parents, I want you to take care of the child and the state pays us, but we don't want my mom to know that I'm going through this, or my dad to know that I'm going through this. You know, they have anxiety, they're going through a lot more than, just paying bills. And they do not trust their own parents that they're going through a mental health condition that is beyond paying keeping the lights on at the age of 18 when they're living with a child age 3. It's too much. And it's sad that they can't trust their own parents. So believe me, this is very personal to me, where I sit across tables with teen parents who are struggling with anxiety, depression, ask me what, and that's the last thing they should be worried about, right? So we need these young kids, and I'm not sure, they're Roshit and Meher. I hope you bring your presentation, and if you need Danbury on that list, call me. We'll get you on the board. You need to get on the board, present it, so every school in Connecticut get to see that part. Why do we need to bring that as a part of education system in Connecticut? Connecticut is a pyramid state. What does it mean? We are under pyramid model. We are financed, we are funded for the pyramid model. Pyramid model, I did send the resource this morning to, I think, Anita. So that's a space where there's a lot of information. So socio-emotional, that part of it is funded well. but why is that not integrated into the schools where children, you're sending children out to that larger community. You're not getting them ready if you're not feeding in to a complete child. What do I mean is you're not giving, equip them with a tool set, how to react to situations, not just a toolkit to get a job. I hate to take a long, and I think I got to about 10 to 12 minutes. I can go on, but thank you so much for this time. And I absolutely appreciate it. I'm going to stay in my space because I'm not a doctor. I'm in a space where I'm an activist. I want to promote this pot, put in this little worm in every person who sits across my table. And thanks for your time. Jaya, we can hear you.
Thank you so much, Minnie. That was
You're
really
welcome.
good. Okay. So I work in healthcare from 30 years, like since I graduated, right? But from last 20 years, I work in mental health and substance abuse field. And I have seen the struggle, stigma, struggle between the parents and the kids and the young adults, and also treatment struggle, which is sometimes revolving door. It revolves and they go back. So today I'm covering wellness and prevention because we heard from Dr. Mohini, we heard from Minnie. So most of our young kids do not know the yoga and Ayurveda and all these other prevention methods. According to the statistics from NAMI, 1 in 5 adults in United States have experienced some type of mental health problem. 1 in 20 adults have serious mental illness, and 17% of young adults experience mental health disorder. So this is the statistics, but there is a lot behind it because many of them, they have not even recognized that they have this issue, right? So today I'm going to talk more about prevention and wellness because that is not being taught in the schools. And I hope in the schools, they should give priority to yoga and meditation. So my specialty is Ayurveda. I don't know if you all know, but Ayurveda is the science of life, and it is originated in India 5,000 or more years back. It doesn't mean that back then or now there are no issues of behavioral health, but that time and now, India, now I don't know, but that time they had so much of family backup and support. Social support. So defining health in Ayurveda also, it's body, mind, and soul, harmonious balance of body, mind, and soul. So it's not alone the physical body, but mind gets treated whenever there are issues. I would like to say that, we also have our self-power. We are in a rat race, and we forget that we have empower ourselves to give it to the family and friends. So too often we underestimate that power of touch, just to give a hug, a smile, or some kind words, a listening ear if someone has a problem, all of which have the potential to turn around the life. So as per Ayurveda, there are signs of healthy mind, right? If someone has a healthy mind, they would, take proper diet, they will remember their stuff, they will organize, they will be very organized, they will have healthy memory, following good values, they will have responsibilities, self-awareness, maintaining self-hygiene and cleanliness and all that. They will be more enthusiastic doing stuff. But what happens when there is imbalance or unhealthy mind? The psychological conditions caused by unhealthy mind or imbalances cause anger, greed, jealousy. I'm talking about extreme. Normal anger is normal, but extreme, sad feeling, anxiety, nervousness, fear, unhappiness. So there are many diverse reasons of this mind imbalances, like emotional stress, occupational stress, that is very common these days, trauma, poor upbringing, because upbringing is very important in Ayurveda. Even when the fetus is developing in mother's womb, there are sanskaras given to the fetus until 9 months. And when baby is born, there are sanskaras. When the baby become younger and younger, there are a lot of sanskaras by age that they are given in Indian culture, and they were so important. Then the other triggers of mind imbalances are sexual abuse, drug abuse, excess thinking, the influence of disturbed individuals. So all these impure actions cause like this anger and hate and nervousness and worry, apathy, dullness, and sleeplessness and all this. But in Ayurveda, there are quality of mind described, right? If some of you know, Sattva, Raja, and Tamas, those are 3 gunas are described. Sattva is described as a natural state of mind, which is the best mindset. And that can achieve optimal mental health. It is characteristic of the mind that lets you feel very light and productive and balanced. But it doesn't mean that everybody has a sattvic mind, right? Rajas is the ambitious quality of mind, which makes us, little restless. And the tamasic mind is the attribute that makes us feel lethargic or dull. But all 3 are important. The balance of 3 is really important. However, the imbalance, if there is any, then the gunas can lead to the depression, anxiety, and all these things. So how do we help our body and mind to build this sattva in our body, right? So I'm going to give you just 6 simple changes that you can make to your daily routine, the parents and kids and everybody. One is pranayama. That is the practicing pranayama, the breathing exercises, focus on inhale and exhale and hold for a few minutes. And so once your body experience the calmness, it will crave more calmness and attract a similar type of energy if you practice every day. Then second is meditation. So meditation is not for the retirees or the old people. This is for everybody. It is age-old healing for the mental instability. And it rewires your brain into becoming more present and mindful. So there are studies done, and I'm going to briefly talk about those studies on meditation practices. And they have shown that meditations are more likely to be able to breathe through anxiety and deal with depression in a positive manner, and also build better relationships and deep connections with fellow human beings. Balance of sattvic diet, which is very important. It is not only important in order to build up the immune system of the body, but also to make mind more resilient. Sattvic food means those are like easy digestible food with plenty of fruits and vegetables, organic food, whole grains, lentils, so no processed or junk food, and avoid white sugar, and white flour. Then the selfless service, seva, that is also important. So seva, in some families, it is very important, and they, teach their kids. But Ayurveda emphasizes this practice of seva regularly in all of its prescriptions. The key is making small changes on a daily basis so that the body gets used to those new patterns, and body needs time to adjust the new patterns. It is precisely why this sadvrata, it's called the positive practices. Sadvrata of doing seva and all this for the community. It's a good feeling. Then it teaches us more patience, establishing a healthy routine, regular. Then another thing is, besides this, the seva in sadvrutta, it teaches us to regulate our, exercise, meditation, and handle systemic stress, nourishing our mind. So there are multiple positive practices, like develop hobbies and creativity and all that. Then engaging in senses, there is certain type of food which can engage the senses, and herbs are available, of course, in Ayurveda, because when you feed your body, what you feed your body, it reflects your mind, right? So if you eat sattvic food, it reflects your mind becomes more sattvic. So when we harness these positive qualities of mind, we're able to create the state of being that is conductive to healing. So Ayurveda's lifestyle management according to the season and stuff is just for mind and body balance. So balance, how do you balance the mind, right? With yoga, pranayama, and other therapies. And finally, you tune up that with the nature. So I know I only have few seconds now, but I want to give you some highlights of that Neiman's research. That research is done in India. It's called National Institute of Mental Health and Neurosciences in India. So they did random controlled trials in college students for pranayama and yoga asana. And that reduced the symptoms of depression in those college students. The second they did was in hatha yoga practices. It used equivalent to psychotherapy, and that reduced the relapse in opiate users. Another one is yoga and breathing exercises improved the memory and learning capacity in normal school children. Hatha yoga reduced anxiety and depression in normal adults as well. Then there was a study done in meditation techniques as well, and that reduced the anxiety, pain, chronic insomnia, recurrent depression, overall emotional well-being, and that increased the focus and concentration. So I think I'm out of time now. So thank you very much for listening. And now is the time for our young adults to give us their presentation. So I would invite Anita to introduce them.
Thank you, Jaya. We've heard so much and received so much valuable information from the experts. But we also know our youth leaders have so much to share, and they are doing a lot. And they will introduce themselves, so I don't have to do anything, any of that. But I do want to, and I think we all felt very strongly about the person who's been working with our young activists. And we would like to actually acknowledge Laurie. I don't know if Laurie can be seen. Maybe we need to bring her in. Uh, since 2014, Laurie has served as an advisor to the Mayor's Youth Leadership Council, which is a program of the Stanford Youth Services Bureau. Based at Vestal High School and AITE in Stanford, Laurie works with student activists on several issues, including mental health. So thank you so much, Laurie, for all your work. And we would now like to hear from our young leaders. So take it, Rashid, Meher, and Rashid. Thank you so much.
Thank you. Thank you for inviting us. Let me share my screen and we can start the presentation. All right, so thank you for inviting us to this beautiful Friday night. I'm happy to present to you guys along with Rashid and Mahir. So our presentation is behavioral health, stigma, wellness, and prevention. Our main goal is to share information with you all and also speak about our own personal experiences. So our presentation is broken down to 4 parts: mental health, stigma, prevention, and finally our citations, which includes our references. But before we dive into that, who exactly are we? So my name is Roshan Jagannathan. I'm a senior at AITE, the Academy of Information Technology Engineering. I'm also one of the executive members of MILK, the Mayor's Youth Leadership Council. And our main goal over there is to spread awareness on mental health, sexual assault and harassment, and suicide prevention. And next year, I'll be attending UConn stores and majoring in physiology and neurobiology. Hello, I'm Rashid, and also Rashawn's twin, as you can see. And I'm also from AIT. I'm a senior going as a local exec at AIT, going to UConn stores, also majoring in physiology and neurology in an honors program and the STEM scholarship.
My name is Meher Jain, and I am a sophomore at Stanford High School. I am also an executive member of the Mayor's Youth Leadership Council. I'm so excited to be here. I really enjoy spreading mental health awareness at our schools and across the community, and I can't wait to share more with you guys.
So first topics about mental health. And we have a quote from Deepika Padukone. You guys might know her. She's a famous Bollywood actress. And she said this quote at a convention a couple of years ago. And she's also a strong advocate for mental health. And she said, I've come across situations where people who are experiencing mental illnesses want to seek help, but a family won't allow them to do that. And I found this quote to resonate with me a lot. So usually over the summers, I would go to India to visit my family. And whenever we go to India, the conversation of mental health is brought up. And whenever like my relatives would talk about it, it's more of a taboo concept that they misunderstand a lot. And I would hear mental health being associated with the idea of being crazy or mental health not being real. It's more of something that's not close to physical health. And whenever I would hear these conversations, I would just be surprised because I understood that mental health is something that affects everyone, even if you're young, old, or if you're not even aware about it. It's our social well-being and how we feel and to like external stimuli. And I found that their words to be not true at all. And when I grew up and kind of got older, I realized that even more. And especially when I became executive member at Milk, I would like understand that those topics were very stigmatized and not really understood properly. So on the screen, you can see the effects of negative mental health, and the right side is the positive mental health. And we chose topics and causes that we felt very prevalent among teenagers, especially in Stanford and the Brown community. So especially as a high schooler, I think anxiety is something that affects everyone in some sort of level. So academic overload, I think I find that very specific to me at least. So as a high schooler in Brown community, we have this high expectations to meet the expectations set by parents. I find that to be really true because most of us weren't really born in the United States. Most of us could be born in India, and we migrated to the United States at a young age. And I think it's a label that moving from the east to the west has the label of you have to study harder, meet expectations of the West, and that's this label of prestige kind of. And I think meeting that expectation is something that's very difficult, especially as kids. And you see your parents working harder, working overtime, maybe coming home late. And I think as parents, the main expectation you have for your kids is to be good in education, because as kids we're surrounded by school all the time. But at the same time, you have to understand there's more to life than the school. As people, we have a social life, we have stuff to do outside of school. And I think this is constant cycle of feeling hollow, maybe lightheaded, and it just kind of eventually builds up to the idea of not wanting to go to school at all, and this anxious feeling. I think we all felt this anxious feeling at some point in our life, and maybe not as large or small, but this anxious feeling is a human emotion that has to be acknowledged and confronted eventually. And I think once it is confronted, we have this more positive outlook in life and this positive side to mental health that brings along to academic success, stronger social skills and confidence. And I think this is brought up along by talking to your parents, talking to how you really feel. I think it's fine to say it's okay to not be okay, and talking to your parents that how you really feel, and improving your sleep schedule and being more resilient to its changes in life. And I think especially as growing up with a different culture between American values and Indian values, we have to understand there's a culture shock that we have between our parents too, because they might be more right to the Indian side, not to the American side. I think that transition between those two cultures is something that we have to understand as kids and as adults. And in regards, I kind of touched base on this before, the immigration story of it. So I guess to my personal anecdote. So I was born in India. I was moved to the United States when I was 5. Then my family actually moved back to India for a year because they felt homesick. Then they realized the job opportunities here were better, so they moved back after a year. But I found this article from the Times Writers, and I found that to be very I think it's very connecting to me. So this story is about the immigrant story, and this author is from India too, so she has a strong perception of this perspective. And I'll read one of the quotes. I'll read the bottom one. It said, in a country where immigration to the West has long been seen as a passport to prosperity, the cultural contradictions between the households is a familiar story. And I find that to be very true, because moving to the West does have this label that you have to meet up. And sometimes it's hard to meet up with that. And is I think acknowledging that good mental health is not a luxury. It's something that we have to work hard to. And I think that builds up the pressure. And I think to confront the pressure, the best way is what we're doing right now, talking about it, educating about it. And I think the presentations before did an amazing job in showing how powerful it is to talk about it. At the end of the day, all you have to do is talk about it and acknowledge it. And I think that brings a better step towards the right direction. All right, so moving on, I'll talk about stigma that was briefly noted throughout this whole meeting, and talking about the definition, my own view on stigma and how it's affected me. So I have it in the slide, I have a brief description of what stigma is. And in the first paragraph, I mentioned how it's a collection of negative and unfounded beliefs that a group of individual or one set of person can believe in. And I also want to briefly highlight the idea of cultural stigma, because I remember Dr. Mohini kind of mentioned this before, but especially in a brown community, there is a stigma, especially a cultural stigma, especially moving from the East to West. And it could also play a judgmental role in a victim seeking assistance. And for what Sean talked about, that we moved from India to New Jersey, and for around we lived there around 2 years. And I remember that a stigma within my family for a brief period of time, mostly because we were struggling and having some problems in terms of finding jobs and for us going to the right school. And I feel like stigma can be a barrier to any individual because there's no sense of compassion. And in my next slide, I have a table describing about the subtopics that I want to talk about for stigma. So, like mentioned before, there is a reduced chance of receiving care. Around 16% of adults with mental illness don't receive care. And that could be a problematic in a teenager's perspective, since we can have a poor prognosis in the long run. And I feel like the main idea or takeaway that I want to highlight about stigma is a sense of compassion that must be involved in a family. Because once you don't talk about a certain problem, like for example, depression or anxiety, that can be misunderstood for laziness or lack of awareness. And you have to be honest as a parent and also a child, because it is hard to talk about mental health in the community where you have to strive for academics. But also, you have to understand that academics is not one defining factor about who you are as an individual. It's also emotional skills, the way you speak, the way you behave. And you have to use your social life and as an aspect to become who you are. And for me, when I was in high school in ninth grade, I was pretty unaware in a way about mental health, because I know that it was a somewhat taboo concept in my family. And once I joined Milk, I realized that the main aspect about mental health is seeking vulnerability. And you have to be open and you have to be honest. And for what we do as a Milk exec, that we have Monday meetings where we talk about our own mental health. And once I talk about my own mental health with my peers, I realized that the main idea of talking, of seeking mental health problems is by talking and having a sense of family. And you must have a family in your household. And talking about stigma and degrading that negative aspect is pretty essential for seeking a well-rounded community. So another topic I want to talk about alongside with stigma is being over dramatic, because having a cultural stigma around mental health could be detrimental about what you believe in. I can't briefly note about this because having depression could be laziness or being anxious or lack of awareness. And you can't use those labels to define an individual, because every individual is like a piece of art and you have to be respectful about who they are. And you can't be over dramatic of comparing us to others. And main idea of like in the brown community, like the toxicity behind it is comparison. And you can't say this can't happen to you. You're having a better life compared to X, Y, and Z. And you can't really have that negative stereotype, because it will be like a brick wall for your child. And you have to be open, compassionate, and talking openly about your problems and trauma.
So the last and final thing that we want to talk about today is some prevention methods and just some ways that we can catch it early, how we can deal with mental health and just help each other no matter what everybody's going through. So first, we'd like to give us a couple examples of mental health first aid that you can provide to your child, loved ones, or anyone that you know that may be struggling with mental health. The first one of the listening is the most vital part of dealing with mental health and helping others get through mental health. Sometimes it's tempting to jump immediately to the conclusion that, oh, they don't know what they're feeling. They're too young. It's a regular emotion. They'll get through it. But that is the thing that we were just talking about, stigma. That's the brick wall that's going to stop mental health from being treated and stop that and continue that statistic of teen mental health just growing. Because the sad truth is that mental health in teens is very, very real, and it's increasing drastically, especially in this generation, due to many things like social media and the increased academic pressure that's put on this generation. So it's important that we listen to each other and just understand that your child probably knows what they're feeling, what they're going through. They're going to school for 7 hours a day, and they're at extracurriculars for another 2 hours. They've got homework for another 2, 3, 4 hours even. A lot of the times you might not see what's actually going on, which is why it's important to listen to what they have to say and be understanding of what they're going through. Which leads us into the second point. We can't judge people for what they're feeling and what they're going through. Everybody has their own story. How you might deal or perceive a situation is never going to be the same with how your friend perceives it or your child perceives it even. Our lives are very different now, and mental health is exactly that. Your mental health is going to affect how you perceive or react to a situation, which is why it's important that we can't judge each other and we can't put up that barrier to stop that person from coming to you in the future. We need to make sure that it's a safe space, so for them to trust you and be able to speak openly about it. Like we talked about previously before, talking about it, being able to talk about it openly is a great way to help mental health and help people get their emotions out there, and it's the next step to being able to feel better. Another thing that we should be always doing is giving support to each other, helping them, giving advice whenever you can, advising them to breathe, or just giving them a friendly smile every day and making sure that they know that you are going to be there for them always. That is super important. Pushing them away, dismissing the problem, and just avoiding the mental health topic, that is not giving support. And we need to make sure that they know that you are there to give them support, and they shouldn't feel that they can't come to you as a parent because they feel that you're not going to understand them or you're not going to accept that mental health is real. That's not being able to give support. And last but certainly not least, asking for professional help is often regarded especially in the Brown community as a last resort, as something that you shouldn't really have to go to. That's for the most extreme cases, but that is completely far from the truth. Professional help you should be able to seek it as a great option instead of a last resort. It is super helpful, and you should be able to feel comfortable seeking out therapy or just any sort of treatment. It is a great resource and should not be disregarded. So with that, we'd like to move into some more things that you can do to help your mental health on a daily basis. They should be included into your routine to even prevent these issues from being exacerbated or occurring in the first place, which is things like practicing mindfulness, practicing yoga, being patient with each other, reconnecting with yourself and practicing self-care, or connecting with your friends and your family, and making sure that you're going out and talking to people, making sure that you're always hanging out with your friends and making that time and place to be able to do that. And also being active is great for your mental health, exercising, even going outside, maybe joining a sport. It's important to realize that academics are not everything. And in the Brown community, that's pushed so much that you have to make sure you're on top of your academics. You have to make sure you're doing this. You can't hang out with your friends today. You have to do your homework. Well, that's completely not true, because you need to make sure that you have a great balance, because if you're too overloaded with the academics and you're not doing these things to help your mental health, and your academics are going to fall. So you need to make sure there is a great balance in between all these things. And finally, we'd like to talk about some resources that students have, or adults, anybody has, that can help you with your mental health. So we know that in Stanford schools, we have talk spots all across our Stanford schools. And what talk spots are is basically we have these green floor decals in front of the areas or the rooms or the teachers that places that you can go where they are safe spaces to talk, so they're in front of like your school health center or your mental health officer, whatever, all these places, your guidance counselor. These are places where you can go to receive to receive mental health resources and to receive a safe space for people to talk. Another thing that we have are Kids in Crisis. It's a great resource. Every school usually has a school-based health center, which should be encouraged. You should encourage the usage of your school-based health center. They are great resources. We also have a couple of some numbers that you can call if you need therapy, like a community health center. Also, there is mobile crisis lines, such as the National Suicide Prevention Lifeline or the Mobile Crisis Intervention Services. Great resources, great numbers that are they're very useful to know. And finally, we have this mental health brochure guide. This is basically a brochure that we give out in our schools, and I think it's going to be sent to all of you. I'm not quite sure though, but it's a great brochure. It has a lot of facts on it about mental health in students, adults, numbers that you can call, tips for your mental health, and so much more. It's an incredible resource, and it should definitely be spread around more schools. So with that, here are citations, and thank you so much for listening to our presentation. And we hope that if you have any questions, at the end of the presentation, at the end of the call, you can put them in the chat, and we'd all be happy to answer. Thank you guys so much.
You can unshare it now.
I am I have no words. I mean, hearing from our young leaders, I think we have learned not only from the experts, but I think it's so impressive to see and here are youth taking the lead and you know, and speaking from the heart. So thank you so much for this conversation, a very honest conversation covering the whole spectrum from prevention to, you know, what are the signs, what are the anxieties, and how important it is to address mental health. The chat is now open. I mean, we invite our participants to pose any questions they would like to the panelists. We have received some already. So I could actually start with those while others are kind of,
Writing
you
them.
know, writing them up. So I think one of the questions and one of the issues that was touched upon is, if sadness is a symptom of depression, do you mean any sadness is depression and needing treatment? What's the difference when you seek treatment? And I think Dr. Ranganathan had touched upon it. So if you could address that. Thanks.
Sure. I'm not really sure I can follow the last presentation. I feel like I should just stay silent and let all of you do the talking. But let me try to answer that. That is such a common question. And the reason it's important is both because people are afraid to talk about sadness because they think they might be overdiagnosed with psychiatric diagnoses. And sometimes they think, well, oh, I'm sad, and you know, my job is really stressful, or such and such thing is really stressful, and so that's not depression. So let me just answer facts firstly. If you were seen by a doctor, only sadness doesn't equate to a diagnosis of major depression. So we can see individuals who have sadness and do not get diagnosed with major depression. And we also see individuals who are diagnosed with major depression when sadness is not their main complaint. And this is true for anxiety disorders as well. So it's not unique to depression. And it's also confusing, you know, because depression, anxiety are words that we use in our daily conversations. Oh gosh, I'm really depressed today. I'm feeling really anxious, you know, on this meeting today, etc. And but it's also terms, right, that we use in the clinic. But what we actually use to diagnose are a constellation of symptoms. It includes some self-subjective symptoms like sadness, like feeling anxious, but it also includes other ways, common things: sleep, appetite, energy, ability to concentrate, ability to handle stress, feeling very guilty, feeling hopeless, the sadness or the anxiety or the worrying and rumination is starting to affect your life. You can't seem to break that cycle and move on. And it's the constellation of symptoms and how much it is impacting your life that is taken into account for the diagnosis.
Thank you so much for that. Another question, and I think this is really pertinent to what we're talking about today, is what does culturally sensitive mental healthcare look like? So I think all the panelists could say something about that.
Okay, I'll start.
Okay, that's fine. You can start. Please start.
Oh, okay, I'll be very brief. It's obviously integral to both engagement and treatment, right? Because it really is important for us to feel like we have a good fit, and being culturally informed or culturally humble and culturally curious is really key to helping an individual feel like you have a good fit. It doesn't mean you have to know everything about the individual. I'm from India. That doesn't mean I understand every Indian perspective. And that is true for therapists who are not from India or not of Indian background as well. But really being able to provide that space where we can understand what those cultural influences are is critical.
If I may, culture plays a big role, honestly, because there is a relationship piece when it comes to, if it's a therapist with the person you're working with, the relationship piece pretty much weds well when you understand the culture part of it. So it's important that the doctor or the physician, the person in that capacity, working with that person who needs help, who's struggling, who have their struggles, understand the culture, the cultural perspective, to come up with how can I help you in your own space. And it's very important.
Yeah, and I agree with both of you because I remember there were circumstances where in my facility, there was no Indian doctor, but we used to have, Indian kids and adults too, to come for the counseling and stuff. And they used to seek like, oh, do you have anyone who can, I mean, it's not like they don't understand the language or anything, but they wanted someone who can understand the culture. So there is kind of a need that people want someone who can understand a little bit of their cultural background.
Thank you.
And
And
it
I
helps
wonder,
in therapy. It really helps in therapy.
absolutely. Would Meher, Roshan or Roshit want to add? And we have a question for you after this. So go ahead if you want to add to this conversation.
Yeah, thank you for inviting us. But I guess the main idea for like teenagers, and we also mental health, is the idea of being listened, like having a place or person to listen to. And it doesn't have to be the adult receiving or giving back information. It's simply someone to like a human talking to, that compassion I talked about. And personally for me, my older brother was a big influence. I have an older brother named Sean. And like he helped me a lot in terms of like my high school journey, because he has some wisdom sometimes about his own mental health journey. And like I feel like having a great resource, you can be a therapist, for example, but it could be also be for me, my older brother, having a place to like a person to talk to. And especially with mental health, with like rising social media like TikTok, you can easily be like influenced by like bad like influences, for example. And you just need to have someone you can trust too. And having a sense of trust and urgency is pretty vital, in my opinion.
Absolutely. I'm keeping an eye on the time. We are over the hour, but I think we would
That's okay.
like our youth to answer.
Yeah.
I mean, the comment is great presentation by the youth, must be doing a great job on the mayor's team. Have you organized a mental health event for Stamford schools this month or over the past few months?
I can add that, and Rashawn and Mahir can also talk about our perspectives. So we have like events every week since September, and like it'll be like the mental health awareness on like this May, because May is mental health awareness, and we have like wristbands. Like I have one in my table. It's like mental health matters, and we have like an adjective resiliency, and we usually like, give wristbands to like, the students at lunch, or like anytime we have like, free times, like free periods, for example. And alongside with our wristbands, we also have brochures. And we usually do that every week. And we have lunch tables where we come up to people and ask questions. That's what we mainly do in terms of events. But we also have like outreach. We go to middle schools and we talk about mental health. We go to classrooms, so we have presentations, like an hour-long presentation. And Rashawn and Mahir can also talk about their own perspective.
Please.
I can add on. So I go to Stamford High School, and at Stamford High, we do a lot of this similar things like giving out bracelets, giving out information about mental health, because spreading mental health awareness is really important to break the stigma around it among students. And it really helps, like you can tell among the student population that, mental health is so much more of an open conversation. It's not really a very touchy subject. Like I can talk about it freely and not feel any judgment. Another thing that we've been doing is we've been promoting Stamford Public Schools has 2 mental health days that you can take for, as a student, you're allowed to take 2 mental health days off of school. And we found that a lot of people didn't really know that you had this option. So a big thing that Milk has been doing is promoting it and making sure that all students are aware of it. And I found that this year, like so many of my friends have used their mental health days and found it very, very useful. And they weren't able to use it last year because they didn't even know it existed. So things just like awareness is something that Milk does a lot, and it's been really helpful.
And to quickly add on to that, we also have a podcast The podcast is very popular. We have like more than 500 viewers and stuff. So in the podcast, we just talk about mental health topics. So these topics that we find very relevant to us as teenagers. We actually had an episode a couple of weeks ago about meditation, and we talked about the importance of meditation, reconnecting with yourself. I think we have an episode every month. So the most popular episode, I think, on the top of my head so far was, I think, the one in October. We connected with Harvard Active Minds. So Active Minds is a non-profit organization in colleges, and they talk about mental health topics. And Harvard had one, and we just connected with them, with the co-presidents, and they talked about their journey with mental health and transition from high school to college and how it affected them, especially in a very academic profile school. So yeah.
This is all very impressive. And I know just in the lead up to this event, I've learned a lot what the youth leadership has been doing doing for mental health and other issues. And I did take what the Youth Mental Health Alliance offered in April, which was a mental health first aid training.
Yeah.
So very happy to learn and kind of be there. Like you said, all we need is somebody to listen and to support and not judge. And I think that's the key message we can take with us today. I think Ashwini would like to wrap up the session today.
Yeah, I have something to say for our youth leaders today. So they did really a good job, and I would like to invite them to write a press release. Usually we write a press release, someone within our board members or someone they write, but I would like to invite you guys to write a press release of today's event, and I will help you. So you can connect with me and I will help you. And we decided to pay some compensation as well. Okay.
Cool, thank you.
Yeah, and that's a great idea, Jaya. I was thinking about it.
Thank you.
And
Thank you
we
so
promise whoever is attending today, we promise to circulate separately the resources, the flyer that has been posted here. And Minnie and others also shared some resources. So we will try to compile them and share them, with all those who participated. And thank you so much for coming today on Friday evening to be part of this conversation. And I will hand over to Ashwini now.
Thank you, Anita and Jaya. Can everyone hear me? Just thumbs up. Great. Acknowledging of mental health issues, taking steps to manage symptoms, and sharing one's story to seek help takes tremendous courage. We share this invitation with professionals at Presbyterian Hospital, Cornell, Stanford Hospital, Greenwich, St. John's Episcopal, the VA, and teams in various banks and organizations, such as BNP Paribas and Citibank. We also shared it with the Queens Lions Club, the Richmond Hill Club's Rotary team, GOPIO New York, and health professionals in the Guyana Ministry, which is where I'm from, Guyana. Thank you, Anita and Dr. Daptardar, for your passion for wellness. It has not gone unnoticed. I think it's fed off a bit onto me as well, so I appreciate that. Thank you to our students and the healthcare panelists in today's program. You are true healthcare advocates, and thank you to our previous GOPIO sponsors, Braj Agarwal CPA, movers and shakers in healthcare in New York, Dr. Hamid, Dr. Prasad, Dr. Bindu Babu, who joined in today's call just to support our initiative here at GOPIO. Also want to thank Indira from CUNY College in New York, MSW Ushwani Prasad, that's my twin sister. And thank you for taking time out overall. Also want to thank our GOPIO chapter members in Connecticut and New York for joining. You are GOPIO, and without you, we wouldn't have today's program. So we hope everyone walks away with something to ask for more of these seminars. And I love that mental health first aid checklist that was provided. So thank you so much to our students for doing that. And most important, we are growing our GOPIO team. So we welcome everyone to join us, as I did a few years ago because of Jaya. So thank you, and I hope we can see more of our youthful members in our GOPIO family.
Yeah, so just remember, we have we will send you the membership form, fill out the form, so you will be a part of GOPIO. And we have some events, youth events too. So we'll invite you.
Jaya, may I introduce two people from GOPIO International?
Sure.
We have Shatrughan Sukhdev from Toronto. And then we also have we also have Nami Kaur. She's our international coordinator. She's from Yonkers, but currently right now in California. So
Thank you for joining.
yeah, thank you.
I want to
congratulate.
an excellent presentation. All of you did such a marvelous job. I learned so much, and I want to give a shout out that keep on doing this great work. So thank you.
Thank you.
Jaya,
I think I'm going to stop the recording. If anybody wants to say anything, I think we have